If you've had trouble finding a mental health provider, it's likely because more than 160 million Americans live in areas where there are shortages.
And the situation even worse among professionals who treat children. But one St. Paul pediatrician is offering up a potential solution, and it starts with doctors just like her. Here's Fox 9's Rose Schmidt.
Every day that I see kids, we're helping with mental health concerns.
It's a difficult reality for pediatricians like Dr. Rachel Peterson-Wynn, who works at Children's Minnesota in St. Paul. She believes the situation was especially bad during the lockdown part of the pandemic.
I was seeing kids more than once a day with suicidal ideation. I was seeing younger kids than I'd ever seen with suicidal ideation.
But it's still a very present situation for families now. Almost a third of Minnesota students struggle with long-term mental health problems, according to the state's student survey last year.
I would love to be able to refer all of the patients to a psychologist or a psychiatrist, and it's not possible. If I refer them, they're sometimes waiting 2 months, 6 months, or 2 years to see someone.
To help alleviate the severe shortage of mental health providers, Dr. Peterson-Wynn believes pediatricians can learn to diagnose and treat common conditions like ADHD, anxiety, and depression in their own offices without having to refer them. She works with a nonprofit that trains providers and hospital systems. Though mental health wasn't a big part of primary care training 20 or even 10 years ago, she says it's not too late to change that.
When we can feel confident in that diagnosis and start that treatment, often we help kids and families pretty quickly. And then that leaves space and time for the mental health specialists to see the kids that are more complicated.
Federal data shows more than 8,000 mental health professionals are needed to have an adequate supply. And here in Minnesota, 80% of the state's counties are designated as having a shortage. In St. Paul, Rose Schmidt, Fox 9.
As always, if you or somebody you know is having thoughts of suicide, please contact the Suicide and Crisis Lifeline at 988.
The Minnesota Department of Health releasing their weekly influenza and respiratory illness report earlier today. It shows influenza hospitalization rates remain low, while RSV hospitalization rates increase slightly but still remain low. And COVID-19 hospitalization rates remain similar to last week following a slow increase over the past 2 months.